everyone. This is James Templeton with the Templeton Wellness Foundation. And I'm very excited today because we are back with Joe Tippens. If you missed the first interview with Joe Tippens, you missed a real interesting video and interview, and you got to check it out. We had a lot of people that watched that video, and Joe has quite a story. It's unbelievable how this man recovered from using, the main thing he did was use a worm medicine for dogs. And I guess it was a $7 worm medicine. So it's not very expensive, and he has quite a story. And he's going to tell us all about what he's doing now and the things he's working on to get this message out there even more. So anyway, first of all, I'd like to mention, of course, again, I'm going to mention my book. I used to have cancer, How I Found My Own Way Back to Health. And if you don't have my book, then check it out. I think you'll like it. I think it's a great book for someone that's going through cancer or for yourself. And it gives you a lot of good tips, a lot of good things that I discovered as a stage 4 cancer survivor myself many years ago. And the things that I did are in the book and what I would do if I had to do it over again. And I think you'll find it very, very useful. And all the proceeds from this book, I used to have cancer, How I Found My Own Way Back to Health, go to the foundation so that we can continue to do these kind of interviews and help as many people as we can, especially give people hope. And that's all we're selling here is hope. We don't want to make a dime from anything, and we just want to help as many people. And I think that's the most important thing. The other thing I want to mention real quick is that we have a restaurant guide. I know there's a lot of restaurants that have been closed now. We're going through the virus thing right now, and hopefully that'll end up sooner than later. But there's a lot of restaurants out there that are healthy now, healthy, organically oriented, farm-to-table restaurants. And we've got a restaurant guide. It's called the Templeton List, templetonlist.com. If you go to the templetonlist.com, you're going to find the healthiest restaurants in America. You can just it's as easy as clicking a button, and it takes you wherever you're at in the country. You'll find the healthiest restaurants in your area. And every day we're finding new ones, and there's a lot of great restaurants. If you've got to eat out, and some of us do, it's very important to eat as healthy as you can, in my view. And if you have cancer, I would probably recommend that you try to eat at home as much as possible, because you have full control on what you're putting in your body that way. But occasionally we all need to go out, or we have to travel for a living. And, you know, you got to do what you got to do. And check us out, templetonlist.com. Okay, Joe, it's great to have you back. Joe Tippens, it's wonderful to see you. You look great.
Great.
You know, you have quite a story to share. You know, we could kind of touch on it again. This is a second interview. This is a follow-up interview. But you have quite a story, and can you just tell us real briefly in just a few minutes a little bit about your story again, so that people that didn't see the first one can get a sense of what we're all about here?
Well, since we did the full one several months ago, I will give you the Reader's Digest version.
Yes.
In the late summer of 2016, I was about to embark upon a new journey in my life, taking a partnership position in a firm in Zurich, Switzerland. And literally 12 hours before my flight, I already had an apartment there. I had my Swiss green card. I had my clothes were already all over there, and I was about to go over there at least for 5 years. And found out 12 hours before that I had a tumor the size of my fist in my lower left lung that turned out to be the deadliest of the two kinds of lung cancers, small cell lung cancer. I spent the fall of 2016 in chemo and radiation and prophylactic brain radiation And the good news is that was successful in killing the great big monster in my lower left lung. But the bad news is that the small cell lung cancer had metastasized to my entire body, head to toe. And it doesn't take long to Google what that means when small cell lung cancer metastasizes that far afield.
Get your affairs in order, right?
Yeah, get your affairs in order. You got a median life expectancy of 3 months and a less than 1% survival rate. So I am an interminable positive thinker and actually believe very firmly in the positive thinking effect at the cellular level, scientifically, not just folklore. And I stumbled onto a large animal veterinarian the day after I was told to get my affairs in order and go home and hire hospice, who told me this crazy story about this dog medicine that was they believed would have an impact on my life. And not having anything to lose and being a positive thinker, I said, what the heck, let's go for it. And I started taking it in January of 2017. And my next scan, PET scan, wasn't until the first week of May of 2017. And from December of 16, when I had wide metastasis from head to toe, to May of 17, I was NED, all clear. So
that's unbelievable.
To make a long story short, my word started to spread by just word of mouth. And I started fielding 20 and 30 and 40 phone calls a day. And I was having to start from ground zero, telling the story over and over again. And I decided selfishly to write a blog to tell the story, hoping that people would go read the story and not call me. Well, it kind of had the opposite effect. It went literally, that allowed it to digitally go viral all over the world.
Mm-hmm.
That blog it wasn't written until 2018, like May or June of 2018, 2 years ago. And it's now up to, I think, 780,000 views in 98 countries. It's been translated into 2 different Chinese dialects that have now had 3 million views. And literally thousands of people around the world just having the guts to try it. And then into the end of 2018 and most of 2019, success stories started rolling in other than me. And just from my standpoint, personally, I have been all clear every scan since that May 2017 scan. So that's now 3 years.
And you had cancer everywhere.
Yeah, in my neck, my liver, my stomach, my pancreas, and all my bones.
Yeah.
So, it's been really strangely rewarding experience because of all the new success stories that roll in literally every week. And so what I think I mentioned in the last interview kind of at the end is that I was lucky enough to have a major medical research foundation take interest in my story. And while it's not considered a double-blind study clinical trial, because it's looking retrospectively back at patients, they are auditing as many success stories as they can get through. Now, it's a very arduous task because they got to get HIPAA law, legal documents all signed and cleared, and medical files released, and doctors to agree to talk to them. And they're auditing all the success cases. And my purpose for that is real simple. Right now, before that, it was just my story, and people could either believe I'm telling the truth or not, right? And that's fair. I mean, there's a lot of crap and BS out on the internet. So, is this story really credible?
And you don't want to give people false hope, so you want something that people really know that there's a really good chance that this is really going to help them.
Well, I was asked the question very early on, was I worried about giving people false hope? And my answer was twofold. I said, well, first of all, if I save one other life other than me, it's worth it to me. And now it's in the hundreds, by the way.
Yeah.
And secondly, I believe the downside risk of this is just so low that really the only question somebody should ask is why not? Because, rule number one of medicine is don't make things worse, right?
Yeah.
And I really believe that if you're not making it worse, I can't assure anybody I'm going to save their life, but I can pretty much assure them that it's not going to kill them. It's not going to make it worse.
Yeah. And that when you first discovered this, there was a research experiment by, I think it was a doctor that was working with mice that had cancer. And the mice were cured of cancer using this worm medicine. And the doctor came down with issues.
Well, that happened. That story occurred really. I would call it ground. At that time, I would have called it ground zero. I've done a lot of research since then and found out that I believe doctors have known about this for decades, and I can tell you why I think that.
Yeah.
But that she found this story quite by accident. She was implanting cancer in dozens and dozens of mice, all different kinds of cancers in different body parts. And her entire research mouse population came down with intestinal parasites. Well, every zoo in the world keeps this drug by the truckload in the zoo stores because they feed every animal from tiny guppy fish to tiny birds all the way up to elephants this exact same drug for intestinal parasites. Well, she gave her mouse population this drug to save her research. She came back later and found out that it also killed all the cancer in the mice.
Oh, man.
And then, as fate would have it, she came down with 4-stage glioblastoma wrapped around her brainstem, told there's nothing they could do, and she started taking this stuff and saved herself.
So what was it, like 12, like
12
weeks or something like that?
I will tell you that I'm getting all of that story secondhand.
Yeah.
Because she's an employee at a major pharmaceutical company and she's fearful for her job.
Oh, I see.
So she won't talk to anybody.
But
I'm taking it
to similar to you. It's similar to you as far as the time frame of when you started to, get the positive results from it. From as far as cancer is concerned, and no signs of it in scans and things like that.
Well, I'm happy to report that it's no longer about her or me. It's dozens of people. And that's why the Medical Research Foundation going in and auditing all of those cases and auditing those medical files and looking at them very closely. I think the end product will be a white paper that says simply there's really something here that needs to be researched further. Because, and that's credible. Since then, I don't know how many I'm up to. I think it's around, I know there's, for every one I know about, I know there's at least 2 more out there I don't know about. Because we don't know what the numerator is. I don't know how many thousands of people around the world are following my blog.
Or taking fenbendazole.
Right. I don't know how many that is. And they fall in literally 2 broad categories. About 75% of the success stories were also taking other allopathic standard of care medicines concurrently with and parallel to taking my protocol. So you could logically ask the question, well, how do you know it was this versus that or a combination of?
Yeah.
but I can tell you that I know of about 25% of the cases where they were at fourth stage, dire shape, and this is the only thing they took, and they had success. So there are anecdotal cases out there that are getting audited by a major research foundation that it was only the fenbendazole protocol that was being taken.
So you're taking fenbendazole and vitamin E and curcumin?
Curcumin and bioavailable curcumin,
Yeah.
and CBD, high purity CBD. A lot of people eliminate the vitamin E because they're doing other things that could cause a problem with vitamin E. A lot of people are eliminating the CBD because they simply, in other countries outside the US, CBD is not easy to get.
Yeah.
So, but the two that are very common together is the curcumin and the fenbendazole. And by the way, there's the main research on fenbendazole was done by 3 PhD scientists in India, and they proved scientifically how and why it's working. And one of the 3 mechanisms by which it is working is the production of new healthy wild type P53 cancer-killing gene in your body. And interestingly enough, new research that was done just recently here in the U.S. came to the same conclusion on curcumin, that it stimulates P53. And the other 2 mechanisms that the Indian scientists figured out, one was microtubule destabilization. So these microtubules in the cell wall of a cancer cell are necessary for that cell to be able to replicate and divide and multiply rapidly. And the fenbendazole is basically knocking out those microtubules and disrupting them. And the second one is they proved scientifically that the fenbendazole is interrupting the cancer cell's ability to metabolize sugar. And cancer can't really survive and thrive without its metabolism mechanism is to metabolize sugar.
And that's huge.
Yeah, all 3 of them are huge.
Yeah.
By each one of them by itself is huge, but they proved that the fenbendazole is doing all 3. So I engaged with the help of a local philanthropist. I engaged this medical research foundation, which is over 400 PhDs, by the way, to start auditing all these cases. And they engaged a 4th-year medical student on sabbatical to manage the process. And he's been in contact with all of these success cases. They're only doing U.S. patients, even though there's patients all over the world. And I don't know how much longer it's going to take. It's a slow process, but probably another 2 or 3 or 4 or 5 or 6 months. And then what I really want out of that, selfishly, is credibility, because I get lambasted every week by somebody saying I'm a quack, I'm crazy.
Yeah.
Are you kidding me? What the hell are you talking about? It's really been fascinating for me to watch the mainstream oncology fraternity move. When I started, virtually every oncologist out there says, don't listen to that quack. He's crazy. And then about 6 months later, a few came in and said, well, I think there might be something there and it's not going to hurt you, so why not try? So I'd say today that in the oncology community, probably a little over half will have the opinion, hey, shoot, go for it. It's not going to hurt you. And then the other half are still, this guy's crazy. So well, I don't really care whether they think I'm crazy or not. It's about moving the needle forward in terms of getting people to wake up and pay attention to this as a possible thing in the future. And I believe a major research foundation coming out with a white paper saying we audited 75 cases and there's something here.
Something there, yeah.
That takes the credibility off of my shoulders as a non-doctor, non-PhD, non-scientist out here slopping this story.
Now, when you take the fenbendazole, for example, do you have any side effects that you noticed?
I've never had any, and 90 to 95% of the people do not. About 5 to 10% of the people have reported back mild diarrhea. I've had, out of thousands, I've had 2 or 3 say severe diarrhea. But look, if it's less than 10%, it could be something else causing that, and not the fenbendazole. You don't know.
Well, I mean, it is a worm medicine, so
Yeah.
and then if it's going after worms at all, and you got worms, you would think that you might have a little extra detoxification going on.
Yeah, exactly. Well, there's a sister drug that is human approved, already FDA approved, for intestinal parasites that is getting repurposed for cancer, and it's called mebendazole. Johns Hopkins has completed clinical trials on glioblastoma for mebendazole. The people that started out of the UK, Jane McClellan and a separate organization called Care Oncology, they use mebendazole in their cocktail of 4 drugs, repurposed drugs. So we know that the whole class of anthelmintics, from mebendazole to fenbendazole to albendazole, they all, we think, have efficacy at some level. I chose fenbendazole because I was told to by this veterinarian. I could get my doctor to prescribe mebendazole for me, and any compounding pharmacist can make it very cheap. Mm-hmm. But shoot, the fenbendazole is available over the counter by email, and it's cheap.
It's tablets or capsule, or
it's it comes in all different versions. As I said, it's used for every animal on the planet, from mice all the way up to elephants.
Powder they can mix.
You can get it in a liquid form. You can get it in a powder form for animals, and it's easy to come by. Now, because of me, I was told by a little mole inside of Merck that I've moved the global unit volume up more than 5 times. Mm-hmm. of this sure. Animal medicine.
I'm sure.
And it has become harder to get sometimes because people buy it and hoard it, and the price has gone up. When I started buying it, it was about $6 for a box of 3 packets, which is a 1-week supply, and now there's places selling it for as much as $15. So it's gone up 2 to 3x in price, but it's still cheap.
It's affordable.
Now, and in terms of to answer your question on toxicity, it's not the same drug, because mebendazole molecule is just slightly different than the fenbendazole molecule. But I think they're close enough that you can make this comparison. Johns Hopkins did a toxicity trial on mebendazole, and they determined that you could take twice the dosage I'm recommending every day, 7 days a week, long term. And not
what is that dosage?
Well, I'm recommending 222 milligrams a day for 3 days, 4 days off. Since then, I've had to put a new section in my blog about higher dosages, because people are really funny. If they got cancer, and they're just going to try stuff, and I don't blame them. I think that's the whole reason for the new federal law called the Right to Try Act, is if you're terminal and 4th stage, you should have the right to try whatever the heck you want, right? Well, I started getting messages back from people that, well, I went from 3 days a week to 7 days a week. Then I got messages back that I've gone to double your dosage 7 days a week. And so, you know, there is research that dates back, gosh, almost 20 years that says this drug could have negative impacts on your liver. And that's why it started out at a small dose 3 days a week. But people, I basically recommend people now say, look, if you're able to get access to regular blood tests, and you can take higher dosages and it not spike your liver enzymes, then go for it. If you're one of those people that's not affecting your liver enzymes, then why not, right? So I would say most people are now doing more than my blog recommends. They're doing 7 days a week and sometimes twice as much. Now, the Johns Hopkins toxicity trial said 500 milligrams a day long-term is safe. And my protocol is half that. So I think it's safe.
So
although I would also always say to people, I'm not a doctor, I'm not a scientist, and I'm not qualified to give you dosages and tell you what to take. I'm only qualified to tell you what I've done, and now what I've learned other people have done. And that's all I'm opining on. I'm not saying it's, you know, you should do this. I'm saying this is what people have done.
And if people are taking chemotherapy, I'm assuming that they should probably check with their doctor to make sure if they're going to do this, along with chemotherapy.
Yeah, well, that's why some people, in fact, almost everybody that does any research at all says if they're in chemotherapy, they're going to eliminate the vitamin E and probably the CBD. But I will tell you, when it comes to just fenbendazole, my recommendation, based on what I've experienced with thousands of people, is you should take it parallel with and concurrently with and parallel to anything and everything they want to throw at it. And in fact, as an update, I don't think I'm authorized to say which university yet, because there's discussions going on about a very active involvement, but a major university has reached out to my research foundation partner and said, look, we had 3 miraculous recoveries in our hospital recently. When we dug in to all 3 of them, we found out that they were on this Joe Tippens protocol. And this is a major university, the household name. And they started digging and basically came to the conclusion that this was real. And they want to go immediately to a phase 1 clinical trial. So I'm trying to figure out how, with the medical research foundations that's doing the audit of my success cases and this major university, that they can get together as a partnership or collaboration and make that happen. So eyes are being opened all over the world. Scientists all over the world are going, wait a minute, there's got to be something here.
Yeah.
I'm just trying to push that along as fast as I can. Interestingly enough, this has led me down a path of other research. And I'm now convinced there are over 200 pre-FDA approved drugs that have already been through the entire clinical trial process, all the toxicity studies, deemed to be safe, and they were approved for other disease states. And these 200 plus drugs need to be researched thoroughly for their capability of being repurposed for cancer. And I believe very strongly that out of that 200 plus drugs, that there's going to be more than one cocktail of 2 or 3 or 4 of those together in combination that will arise as new cancer therapies. And the significance of that is none of them have to go through a clinical trial.
Yeah.
If in the United States, if a drug is already FDA approved, any physician is authorized to prescribe that drug, even if it's for a repurposed disease state that wasn't originally intended.
Yeah.
So you have immediate, if that research proves fruitful, you have immediate FDA approval for these various cocktails of drugs that can be repurposed for cancer. And there is a second major university who's leading that effort, and they have reached out to me, and I'm trying to piece all these parts together. Major University 1 wanting to go straight to a clinical trial, Major University 2 researching all these other 200 drugs for possible repurposing for cancer, Research Foundation number 3, and I'm trying to herd cats and get all of them together.
Well, that's great. I'm so glad that it's got their interest, and they're working and they're trying to figure out how they can get this thing done sooner than later.
Yeah. Well, and I also believe, and this really comes from Major University number 1, they believe that fenbendazole in conjunction with immunotherapy is a magic bullet. And if you remember, I'm the ground zero to this story.
Mm-hmm.
I was taking immunotherapy at the same time I was taking this fenbendazole. And the question's always been, well, how do you know it wasn't the immunotherapy that did it for you and not the fenbendazole? Well, I have an answer for that. In the actual clinical trial that I was on for immunotherapy, I'm the sole data outlier in that clinical trial.
Mm-hmm.
So I think there is something to the fact that it maybe is the fenbendazole in combination with the immunotherapy. But I will tell you, I've got another 25% of the cases out there that there is no co-effect with any other drug or any other regimen. They were only doing the fenbendazole. So who knows?
They weren't doing any special diet or anything necessarily.
No, and people get confused by my story, because in my story I tell people that I inadvertently had 8 weeks of fasting because they'd fried my esophagus with radiation. But that can't be the story either for my story, because that happened way before my wide metastasis occurred.
Yeah.
And so, fasting wasn't part of my story because the metastasis came after the fasting.
Well, I tell you what, I'd like to have been a fly on the wall when you went in and got your first scan and they couldn't find anything.
Yeah, it was pretty interesting. And I didn't fess up at that moment because I was on this clinical trial.
I'm sure they were like holding their breath there for a minute or two, like, what? Wait a minute, what's going on here, right?
I didn't fess up to them what I was doing at that time. In fact, that was a May scan. I also had an end of July scan that was all clear, and then an end of September scan, all clear. And the clinical trial ended in September. So I knew they couldn't kick me off the trial. And that's when I actually fessed up to what I was doing.
Wow.
And my physician, my main physician, oncologist, he's in a major cancer research hospital in Houston. He said, you know what, Joe, I will privately, I can't make this the position of my hospital and my staff, but I will privately tell you that I believe what you did was the ticket. But I can't say that publicly because we don't have any research on it.
Okay. Yeah. It's not scientifically proven through research studies and
so my
studies and all that.
One of my biggest frustrations is mainstream medicine are so hell-bent on everything being double-blind study, clinical trial-based evidence. And when somebody has been sent home to higher hospice, you should have the right to throw all of that out the window and do what the heck you want. And I've had, I can't tell you how many dozens of physicians have said to me, well, I don't want my patients taking this, because if it were, if I'm giving them stuff on a pathway and they're taking this too, and we have success, we won't know which one did it. And that frustrates me to no end, because at that point, you shouldn't care what worked. Something worked.
It's their life. It's
their
people's
life.
lives. And,
Exactly.
I mean, I interview people all the time that have had these miraculous recoveries from making, huge changes in their life and their diet and their nutrition and their, their supplementation, all that kind of thing that they do. And they're well, and they've been well. Some of them had pancreatic cancer, you name it.
Yeah.
So there's certain things that I find with almost every person that I've interviewed. If you started writing what's really working for people, you would have a list, and they would be a lot of these very similar things that everybody used. It just, they didn't necessarily do what this one did or that one did, but there's certain things. And nearly every one of them is about detoxification, changing their diet, supplementation, immune system, getting the immune system revved up and being able to do its job. But when you have something like what you're talking about, it seems like, and I don't know, but it seems like that would be sort of a icing on the cake for somebody that was doing maybe some of this other stuff, maybe, you think?
Well, another piece of advice I give as a non-physician, non-scientist is it's deadly cancer and it's going to kill you. So why not throw everything but the kitchen sink at it?
Yeah.
Try all of them. Try the diet. Try everything that you can read about. Have you, in your interviews and podcasts, have you ever interviewed a scientist named Bruce Lipton?
No.
Have you heard of him?
I have heard of him.
Okay. I highly recommend if you can get him on. Now, he is for profit. He has written books too, and he's trying to sell his books.
That's okay. That's okay.
But if you'll go out and look at YouTube, and there's like a 30-minute version and an hour version, an hour and a half version, and a 2-hour version, and a 2.5-hour version. I highly recommend the 2.5-hour full lecture, and it's called The Biology of Belief. And Bruce, as a credible scientist, proves scientifically the connection between what you think and your positive thinking and negative thinking up here affects you literally down at the cellular level. And when you were describing about all the people you've interviewed and they've done this and that and this and everything, I bet you $1 that the other common thread between all of those success stories is positive thinking.
It is. I believe over half of it is believing in what you're doing.
I tell people every day.
And once you start to feel better and start to see that something's working, and if someone just says that so-and-so and so-and-so got better by using this or that, if these people will just let themselves start to believe in something and not have all this negative, cloud over them that I'm going to die no matter what, it doesn't matter what I do. And it's not true, because if all those people can survive, you can survive, I survived. I mean, we were all told to basically, get your affairs in order. There's not much more we know to do for you or whatever. And if we are still around, I mean, for 20, 30 years or more, some of us, and we're still out here kicking and living life into its fullest, then why can't they? I just think you got to believe, and you're right. And that is, believing in that, and the emotional side, the spiritual side is important, but the positive belief, because the more negative thoughts that you have, the more negative stuff that's thrown at you, that starts to affect your immune system.
Okay, so James, listen to me. You and I both believe that. I believed it before I heard about Bruce Lipton. In fact, the day I was told I had wide metastasis from head to toe, go home and get your affairs in order, I can't explain to you why it didn't faze me. I knew with 100% assurance that I was going to kick it.
Mm-hmm.
I can't tell you why I knew that, but I just did, and I believed that. Well, I was already in remission for 2 years when I heard about Bruce Lipton, and went out and watched his 2.5-hour YouTube lecture. And he is the first person I've ever seen in all of my research that connects the dots and proves to you scientifically the connection between positive and negative thinking and your actions at the cellular level. He connects the dots, and it's amazing to watch. And I would recommend you not only watch the YouTube lecture, but try to get him on your show.
Yeah, I'm going to get him on. I'm starting to interview the experts now. So, doing the survivor interviews, but now we're doing the experts also. So that's a good thing. I'll get him on.
Yeah. Okay. Well, your 50% is a perfect number for me. I've been telling people now for 2 years that I believe 50% of my success story was my attitude and my positive thinking.
Yeah, and you just didn't accept the fact that you were going to die, and
No.
you're gonna go to war, and you're going to beat it. If the last person on earth could do it, you're going to be the one. So,
right.
I mean, that's how you have to have that attitude. If it doesn't work for me, it's not going to work for anyone. That's how I looked at it too.
Yeah.
And no one had to hold me by the hand, say, "Now, come on, James, you got to think like this," or "Come on,
Well, some of us are just pre-wired for that.
It's just, I know. And the people that I interview so often are the same way. They're the kind that says, "That guy told me that, and I got up and told him, I'll show you." And they go out and do it.
And
it's
unfortunately,
like
unfortunately, there are people out there that are pre-wired to be negative thinkers. And those are the people I want them to get to see this lecture, because
good.
I don't know if they're pre-wired to be negative, I don't know if they can be changed, but I think they may be able to be changed and be convinced.
I think so. And so you're doing great. Everything's going great with your health. And you said that already. And you're...
Yeah, my business life has been turned up on end because of this COVID virus, but health-wise, I'm great.
And you're still using the fenbendazole still?
Yeah, so I also had to update my blog for this. A lot of people ask me, well, if it's doing these three things, the microtubules and the metabolizing sugar and stimulating P53, and particularly the stimulation of P53, which is the natural cancer-killing gene, why wouldn't it work as a preventative medicine? And so I really now have kind of 3 dosages that people have come to the conclusion of, not me, but the masses have come to the conclusion, and that is, if you're an active cancer patient, go 7 days a week, right? Me, as somebody who's in remission, as a preventative medicine, I'm going to take it 3 days a week, the rest of my life.
Yeah.
And then for people who've never had cancer, just want to try it as a preventative medicine, I say do 3 days a week and pulse it, 10 weeks on, 10 weeks off, 10 weeks on, 10 weeks off as a preventative dose. Mm-hmm. And I highly recommend it as a preventative dose, just because, hey, cancer's floating through your body 24/7, 365, everybody. And the P53 gene is in your body to kill it and keep you from ever having metastasis or the formation of a tumor. And if you got curcumin, is now proven scientifically to spike P53, and fenbendazole's proven to spike P53, and P53 is the animal that goes through your body and kills cancer 24/7.
Yeah.
Why not take it as a preventative medicine?
Yeah, just throw everything you can, because it's not something to mess around with. So,
right. Well, and I would say I continue to research, James. I've probably put 2 man years of research into this, and there's other things that I also believe in. Some of which I'm keeping in reserve in case I ever come out of remission. But I'll give you another one that when I first heard about it, I thought it was kind of like people hearing about me. Well, that's kind of crazy. Really? Is that real? Is that real? And the more research I've done, the more real I think it is, particularly in early stage cancers. And that's intravenous vitamin C. I've never done it because I'm in remission and I didn't have to by the time I've learned about it. But I've learned that if somebody has early stage cancer, I'm not sure it works so well once you get to fourth stage, but if you have early stage cancer, stage 1 or 2, and it's just kind of an early onset cancer and you're trying to nip it in the bud, I really believe intravenous vitamin C, again, is harmless in terms of it's not going to hurt you, but it will do some real good. And there's other things that I've learned along the way that I really believe in. There's kind of a whole cocktail of things that I would take if I came up with cancer again, and I'm going to try to go kill it a second time.
Yeah, because you learn a lot through your journey, and start to say, hey, if a little's good, a lot's better when it comes to cancer, because you want to snuff it in the, in the ground. I mean, you want to get rid of it, and you've got to use everything that you can to help fight. You got all the weapons that you can, grasp.
Yeah. The only caution,
as long as you don't get too over, you need to detoxify along with this. Right. I see that because, when you start to detoxify your body, that becomes toxic with, all these toxins. And that's where I think, and a lot of other people think, that things like coffee enemas, colonics, things like that help to start to push this stuff out and take a load off of the liver.
Well, and the other caution I would throw at people is, if you want to find something on the internet to prove whatever you believe, you're going to be able to find it.
Yes.
I mean, if you want to find research that says fenbendazole is bad for you, I can show it to you.
Yeah.
But if you dig deep on that research, you'll find out that they gave dosages equivalent to like 1,000x, 1,000 times what we're talking about here. And of course, if you take anything at 1,000 times the recommended dosage, you're going to have problems. But
yeah. Well, that's why all these trials are important, because there is so much on the internet, and so much of it is, sounds too good to be true. And a lot of it you got to be very careful with. And I know that. And I've tried a lot of things with different, myself that didn't seem to do anything for me. And, but when you find people that will swear that this really did help them, and the more you have, you got to start to believe, you got to start to think, oh, maybe there is something to Joe's story here, maybe there is something. And these clinical trials are going to be very important.
I think I'm less than a year away of being exonerated with real scientific fact.
Yeah. Well, thank you again. It's been great catching up with you. And,
I appreciate it.
And keep up the good work.
And by the way, I still have an issue. I'd like to, maybe you can help me correct here. I get, and I'm not exaggerating, 40 or 50 or 60 emails a day where they email me from the blog saying, hit the contact button, and they email me from the blog and say, where's the blog?
Yeah.
And then I get another 20 or 30 a day saying, where do I find the blog? Mm-hmm. And so the blog is really simple. It's mycancerstory.rocks. mycancerstory.rocks.
Okay, great.
But people have to go to the bottom and click read more. They can't just read the introduction. So.
Okay, good. There you have it, everybody. Check Joe out. He's got quite a story. I think he's very inspirational to a lot of people, and I think there's going to be a lot of good things coming down the road with all of his information and work that he's been doing, and hopefully these trials will all come through, and we'll get hundreds and hundreds of people that have done well, and then maybe people out there, the powers that be, will start to believe a little bit more. So
I hope so.
That's the important part. And
yeah,
I wish you all the best going forward, and we'll catch up with you another time. And thanks again for being on with us today, Joe.
Thanks for having me. I appreciate it.
All right. Well, this is James Templeton. Thank you, everybody, for watching, and we'll see you next time with another wonderful survivor story, interview, and just keep up the idea that if I can do it, Joe can do it, all these other people can do it that I've interviewed, and there's many other people that have unbelievable stories, whether it's conventional or more alternative. If they can survive these so-called death sentences, then why can't you too? You know, think hard about it. I think you'll realize that you don't have to die. You know, there's always a better way. So anyway, James Templeton here. We'll see you next time.